Welcome to my podcast. Today I'm going to talk about another topic that we are facing in the clinical setting or in the hospital. And it's very mandatory to know how to act. And I've been through something similar with the whole situation. I stated before when I was hit by this e-bike rider who hit me from my back when I was walking the pavement and caused me repercussion, multiple fractures. So it was a very difficult time. So I'm going to talk through the whole case scenario, and then I will put my input just to share and help others, and also to know what to do in this situation. So the case scenario today is about do you feel challenged by a second opinion? It's natural, as we all know, for doctors to worry or panic when their expertise is being challenged, or they feel like nervous as if they have done something wrong. And we know only God is perfection, and those kind of things can happen. And the only impacted person basically is the patient, as in my situation, and I'll just talk about it. So we need to know that the patient have the right to make their informed decision and asking for a second opinion, whether for a diagnosis and for recommended treatment, because sometimes they're not so keen on the suggested treatment, or maybe they have their own thoughts. So you need to explore, and most of the situation information is not given as it should be, or as we know about the GMC guidelines and recommendation, but in reality it's completely different. So the code of conduct have a professional obligation to do so to support patient request to consult another doctor. So in which state is applicable? So it's applicable whenever the patient is unsure about the diagnosis or the recommended treatment. We need also to ensure that the patient have the right information before considering any option or any action plan. Also, when the diagnosis is kind of complicated or it's rare, and this will offer more than one perspective and will offer more confidence in the treatment plan. And also, if there is like a feeling of uneasy and comfortable with the recommended treatment plan. So the patient motivation usually is more personal. However, it can be also incompatible doctor-patient relationship. So what this second opinion will offer? Second opinion can offer like a decrease in the diagnostic error, which is preventable, as we all know. It also can mitigate risk of diagnostic error. It also can confirm the diagnosis being given or offer a new possibility of alternative treatment. Also, it can protect against, safeguard against cognition bias. And when, for instance, one surgeon suggests surgery and other not in favor, which will suit, of course, the patient preferences. And we don't need to forget about it will offer a patient-centered approach, which show commitment to the patient safety and the quality of care to arrive at the right decision for the patient, because the patient is the most important thing in here. It also can help, sometimes the patient might not know about this right. So we need to tell and offer the patient it's your right to have a second opinion if you're not happy about what I've said to you. So this will offer a strengthening in the relationship. We just need to take it from the positive side. And if the patient, for instance, requests a second opinion, if the patient knows that right, you shouldn't or we shouldn't panic or feel catastrophizing or like something gonna go wrong, and we shouldn't feel affronted, but we need to support the patient and striving and for the optimum, of course, outcome. Offering second opinion also decline the medical legal risk and the bias. Also, it's offering the possibility if your patient doesn't know. And also, it will offer another perspective from different ways. Maybe there is a different approach that you're not aware of. So the second doctor or second colleague might highlight about that, so you know about it. However, my situation, when I had this strike or the slam of the e-bike at force, who collapsed on me, and of course, because I was walking forward, so I fall on my followed my nose, my hands, my knees, and obviously had multiple fractures. So I remember my nose was swollen, I had nosebleed, and I had multiple bruises on my face, and my left hand finger was drifted on the other side. I knew it's a fracture, and my knee was completely injured, and my trouser was torn in the knee area. So when I attended the ENT, that doctor who saw me, he didn't tell me that there is a fracture. He just say, "Oh, I can't see in the right side. It's swollen, stuff like that." And he said it's deflected. And I never had any issue with my nose. I never even complained about my nose. I never been even visiting any ENT. And I trusted him by all means. I wasn't even examining my nose. And then I went, like after 4 weeks, as he said, for the swelling to go down. And he said, yeah, swelling goes down now, but there is a deflection. And at that time, I didn't understand what he mean by deflection. And I remember I told him, I'm having difficulty breathing on my right side, and I'm not sure what should be done. So he say, oh yeah, we need to get you an operation. And that moment he should have offered manipulation to straighten the nose, as far as I know, because this is like acute situation. So he didn't do any of that. He just said, my secretary will send for the operation after 3 months' time. And I was living hell, to be honest. And yet till now, because obviously now I have a nerve damage, as when I went privately, that doctor explained straightforward what's the issue. So when that 3 months elapsed and no one contacted me, I called back, and it was his secretary, and I was really in too much agony, and I said to her, when this operation will take place. And I was also panicking from an operation, because I don't know how nose operation is like, and I know that you will be blocked from breathing, so it will be total agony. I wasn't supportive, to be honest, and I was all alone by myself with those thoughts and panicking and stuff like that. I don't understand the situation. Of course, they don't understand. They just think that, oh, this is what you need to do. So that's from their perspective, as as what's written in the books. We need to feel for the patient. If we have the same experience, we will know. Otherwise, there's no point. So when I called back again, I told her I would like to have a second opinion. She said like this, oh, you want a second opinion? Like I said something unexpected. And to my astonishment, within 2 days, I got a dismissive, harsh letter from him without even consideration or explanation or feeling or have sympathy or empathy at all. I was really, really furious reading that stupid letter. It just implies he doesn't have any sort of sympathy or empathy or feeling or whatever you can call it. And of course, with that dismissive letter, you will have to wait another 7-8 months. And when I got that appointment after that period of time, I was seen by a complete different ENT who said that he disagreed with his opinion, and he gave a different opinion at all. And I was like thrown between two that I don't know what's going on. And that time, I started to have alternate breathing. So one side of my nostril works, the other one is shut, and then it switch. And it was, I mean, till now I have it when I sleep, especially. So it's really annoying, and I was like in limbo. I don't understand why I'm having this. And I'm telling now, so this might help others, might help patients, might help doctors that to understand you should be vigilant and understand and know what you need to do, because this is a care of duty. Now he left me with I just need to live with it, which is really hard, very, very annoying. All the time you have thick mucus, you need to get expelled of that. You need to excoriate from the throat, from the nose. And I know why is that, because I'm reading now to understand what's going on. So I remember at that moment of time, I was still hoping that this symptom will go away, but it never gone away, and they only give you nasal steroid on the assumption it's going to help, but of course not going to help, because I don't have any allergy. I'm having non-allergic rhinitis now. So it's a complete different era. And I remember at that summer, I went to the nurse-led surgery, and the nurse pointed out something to me, of course, because I wasn't examining my nose at that time, and I don't know. She said, just face the mirror and see what's that bulge in your left side. So when I stood to have a look, I can see something like, how to say, it's like a swelling, it's like a bulge, and I didn't know what's that, to be honest, and she didn't know herself. So I started to search on the internet to find some answers, because this is specialized ENT. It's not my specialty, and I never had an issue with my nose. And when I studied medicine, we just studied the general ones. And the problem, those who called themselves ENT specialists, they didn't even explain. So how am I supposed to know, me as a medical professional, and how I'm going to expect even patient to know about this? So this is complete mess, I would say. So I got my torch, I got my mirror, and I started to examine. And I can see there's a swelling in the left side. I couldn't understand what's the swelling. And then when I started to look in the internet and see some of the doctors from USA, so they explained that once you have nasal septum fracture, this will cause inferior turbinate compensation on the other side, which is the concave, not the convex. And that's why they will switch. And this makes sense for what she explained. It was a female doctor. And those who I've seen here, no one explained at all, and they didn't even bother. And of course, the GP doesn't know anything. Whenever you go to them, you are the one who's giving them information. And they will tell you we are limited in what we know. So I waited, and I was hoping this will go away. I read in the Mayo Clinic, it says, of course, if it was corrected immediately, this will shrink with time, but it didn't. Till now, I'm talking to you now, and I can feel in the left side, it's bulging now. And I saw it in the mirror anyway, it's bulging. And of course, I'm gonna say like 4 or 5 hours, and then it will switch to the other side. So it's like my life now is just centered about my nose, and my pain, my neck, and my left hand because of the fracture which they didn't correct. And of course, the knee, because it had a fracture as well. And this, of course, will affect my walking, which causing now another repercussion. Anyhow, so they sent me after 18 months for an operation, and it was a locum ENT who doesn't know about my situation. I just got a phone call out of the blue asking me, your operation after 2 days, and this is the consultation. assumably that someone didn't see me, doesn't know about my situation, just say, I'm going to operate you on the day of that. How how outstanding, how it's impressive. I can't understand it, to be honest. Anyway, I don't want to go through the whole problem now, because it's quite complicated, it's quite long one. And it's not sorted because, as I say, I decided to go privately in my own way. After searching on the internet, I just found someone not far from London, and I just sat and I said my symptom, and he just gave me straight away the diagnosis, not like the one I've seen here. They just kept saying, I would say, senseless things, doesn't make any sense, and everyone just says silly things, I would say. And they kept talking about breathe cycle, this is normal. Well, it's not normal, you shouldn't feel it. If you know medicine and if you know what you're doing and what's your duty, you would know this is not normal. And now they just make it for me normal. It's a really hard time anyway. I just wanted to share my experience. I don't want to go into much detail because it's still not ending. I just wanted to explain that second opinion is very important. I mean, it's not shame when you don't know. I just imply that you're trying to help the patient because the patient is the center for your care, rather than being arrogant and being dismissive and useless. That's what I could say. Anyway, I hope you find this podcast useful, and just learn that always try to be sympathetic and empathetic with whatever creature you face in your life, whether it's patient, whether it's colleague, with someone in the street. You just need to help, because we doctors, we need to be kind, we need to be empathetic, we need to be understanding, and we need to put the patient or whatever we know in our shoes and feel for them. Otherwise, there is no point being doctor. Thank you.